Legislation could provide some much-needed relief to hospitals across the state. Today, the Michigan Senate voted on a bill to temporarily allow healthcare workers with out-of-state licenses to work in Michigan.
TV5's James Felton explains how this could help local hospitals.
It would allow for increased flexibility for out-of-state licensed providers to be able to practice in Michigan during this pandemic.
Adam Carlson is all in on State Senate Bill 759. Carlson is the Senior Vice President of Advocacy with the Michigan Health and Hospital Association. He tells us the proposed legislation is the best option to help hospitals at a time when the number of COVID patients is at its worst.
As of yesterday, we had 4,585 COVID positive patients in the hospital. A record high for the state of Michigan.
And that's not all. Carlson says there are more than 20,600 open healthcare positions in the state, along with 875 fewer staffed hospital beds than a year ago.
Each month, more healthcare workers leave the workforce than what Michigan hospitals are able to replace. And it's impacting what Michigan hospitals are able to do as well.
But Carlson tells us state lawmakers are getting the message.
The Senate passed it unanimously today, and so we're very excited about the passage of that legislation. Obviously, lawmakers recognize the significant issues that hospitals are facing right now as we respond to the COVID pandemic, as well as increased hospitalizations overall.
Now the bill heads to the House for consideration. It needs to pass that chamber and be signed into law by Governor Whitmer. Carlson is optimistic that will happen soon.
It's going to give our the hospitals certainty and those staffing agencies certainty going forward that they'll be able to bring people into Michigan who are licensed and in good standing in other states to help with our workforce issues and help provide that necessary patient care here in our state.
James Felton, WNEM, TV5.
According to Johns Hopkins University, Michigan set a new record for COVID hospitalizations this week, and it leads the nation in per capita case rates.